Steve gave us a lot of information on research and already. I must say, many of our research, what we have is American or European. And we in Canada, we are very different. And I did a research, and this is a 2008 research, and it's a Canadian-only research. And when we look at that, what is really important, that kids coming out, we see the 1 to 5 year old ones, 6 to 10 and 11 to 15 is the majority of groups what come out and identify with gender issue. People come out all their life. The research was done from 17 years was the youngest, and 82 was my oldest patient at this time, all with gender issues. So we look at there is a fixed and a fluid group. The difference means that the fixed group is the one what definitely need to transition. They come out transgender, they need to transition, they need to change their gender. Where the fluid group, what you probably heard under cross-dressers. I hate the word cross-dresser, for cross-dressing is a behavior. We all dress in the morning, or we would all run naked around. For it's a behavior, what our society says we have to do. So they do a to identify as the opposite gender. I prefer the word cross-gender, for they need to represent both genders. So we see that approximately half will stay fluid, the other half will stay fixed, what need to change. And then it's about definitely what will say, I don't have issues anymore as they grow up. So that's an important part what we need to consider when we talk. I only give you a small case, and throughout my speech, I come back to this case. It's a 15-year-old boy who came to me, who really wanted to change and needed to transition. He knew who he was. And so when we look at it, when we write it up, a diagnosis, we have to look that the individual comes in as the boy who is a biological male, but it's a female. So we treat him as a female, and we change pronoun. It's her. And that's a really important. I think Margaret put it very well in the cases, how important it is when we talk the right name, when we give them the right pronoun. They open up to us. They are really, we have the trust from them, they are open then. So it's really important when we look at that. We have a lot of what we consider comorbidities, and we feel that they come in, often they brought in by the parents, with depression, enormous anxiety, and suicidalities. This 15-year-old, that was the first thing what he came in with, being depressed, avoidance issues, overcompensation. When we sent them to school, you have to think, they sit in classroom, half of their brain is on the task of hand. The teacher's getting very frustrated often with them. They don't listen. They can't listen. Half is there. The other half needs always to watch. Everybody knows I'm a boy. So do I really sit like a boy? Do I behave like a boy? They really want to sit like this, like all the girls. They look at the girls, but constantly have to watch their behavior. So part of their memories or their brain is always thinking, do I present right? How the society wants. And then they daydream. They daydream who they are, what they want to do, what their future would be if they are different. So that leads a lot to avoidance issues in school. And then we have overcompensations, especially in teenagers, we find this. They need to come in, all the boys going out, playing tackle football, they are rough. And they really like to go with the girls, check their clothing out, what they wear, chat. They are not accepted in this camp, but they don't fit in the other camp neither. So they overcompensate many times and be extra hard, being aggressive. They are pain in the butt really often, but why? For they need to overcompensate. They need to show I'm a boy, even if they don't feel like this. We have a lot of compulsivity. There is the danger. Even they make a little bit of money. They go out, buy clothing, hoard it, stash it, and then get rid of it. Why? For they are ashamed. They feel guilty. So they throw it out, they get some money again, they go buy again. Sometimes it happens, they find something and it's in the pocket somewhere, especially makeup and stuff. They feel terrible about. They are not thieves. They have no money, so sometimes they do some things what they feel really bad. They have somatic problems, headaches, stomach aches, other issues. Dissociation, what we said before, eating disorders are quite common, especially in the female to male. If they don't eat, they hope they don't get their menstruation. They stay boyish, they stay skinny, and they can pass. Steve said the research usually shows that there are less female to males. My research and my experience in my own practice shows equal. They are 50-50. The girls pass longer through, so they don't come out really before their late 20s. For until then, they can be tomboys, they can be really passing. As a female, I can wear bands. I'm not cross-dressing. As a male, I wear a skirt, I'm cross-dressing. So what's the difference, really? We should be all cross-dressers, really. Personality disorders, sometimes diagnosed, quite often actually, borderlines. They are not there, but it's the gender issue what we overlook. Addiction, a lot of addiction. Margaret pointed really out, black market hormones are very common. England only stopped a month ago or 2 months ago that we could buy hormones on the internet. But the best market is in Ottawa, on the streets. We're getting them so easy. So kids trade. One is on hormones. They have the money, they can afford. Let's sell half of mine to you. You do a favor for me. Or sex trade is quite common also. Alcoholism and other drug issues is not uncommon. Learning problems is common, we see, however, too often misdiagnosed, for they are not concentrating. And Steve made a comment before about that they really are not in school, not this good. We have really two. Once they study like crazy, they are extremely smart. They make everything. They're doctors, they are politicians. We have them everywhere. You only don't know where they are, for you don't know who they were before or what is beneath their clothing. For we don't go around and say, see what I have underneath here? So we don't know that. But we have the ones, the underachievers, and ones, the overachievers. And again, we have them quite equally. And also in the research what I did, the income is astonishing. We have a lot in low income. However, we have a lot in high income. So again, it shows us we have them everywhere. They are not uncommon.